if we're all sick, we can't be in this room. And so hell is permanent. It's permanent. I don't believe that the society survive without very good medical public health. No society will survive without good public health. All the school of nursing, the school of midwifery, the school of health technology, all these institutions, they are trained to go into the public health sector so that they'll be able to see it, because the large population is in the rural areas. And so when you don't take care of the rural areas, when you have an epidemic, it spreads very fast. And so you must be able to curtail that by training sound health workers. And they're also providing the necessary requirements to protect our health.
Okay.
It should not just be a mere consulting services, mere consulting areas, like what we are seeing. You must equip them with facilities.
An average man cannot actually pay. Let me use diabetes, for instance.
Yeah.
An average man can't actually foot his bills for his drugs monthly because they are way too expensive.
That's right. That's
for
right.
Government hospital.
That's right.
And then so we have them dying, we have them begging. I was in Juve yesterday, and then I saw a lot of people, mothers with their children, they don't even have money to pay for their hospital bills.
Two things are responsible. Two things are responsible. You see, there are types of some diseases that you don't allow the citizens to take responsibility, especially the elderly. In our society today, we neglect the elderly. When you are between 65 to 70 and above, government tends to neglect you because your productivity is zero. But they have forgotten that you have contributed in the past. And so, there are some medical bills that government should take responsibility to certain group of people, certain ages. There are certain medical bills again. Why I say two is because the drugs that are coming to the hospital, they are being compromised. Compromised in the sense that government orders for drugs to be supplied to all the hospitals within Plateau State. The Commissioner for Health, the Permanent Secretary for Health, the Chief Medical Directors, and the rest of all the management of these clinics compromise. Say, government is not giving us subvention, so they decide to sell the drugs. Possibly the governor don't even know what is happening. He doesn't know. But what comes to his table is that he has approved of 2 billion naira for drugs. He has approved. But these people here don't get it. They get the money, and that is why I always fight against this issue of 5%. If I give you contract, you give me 10%. And that is nonsense. Unless we learn to remove some of these kind of things that are really drawing us back, we will find it difficult to move forward. You supply drugs as a commissioner, as a contractor. I, as a commissioner, am expecting 10% from you. You begin to compromise because you want to give me that 10%. And so if you are to supply drugs of 1 billion naira, you will go and supply maybe the 1 billion naira will not even get to you. It will not get to you. But I'm still expecting you to give me 10%. And so the chief executive, who is the governor, has a lot of responsibility to check these things. You see, I said at the beginning that once election is over, the next thing is governance. And governance is requiring you, the executive, to do some kind of overhead checking. You must create that time. You must. And that is why I said, don't allow what they call these cabals or these sycophants to cycle you. Because when they cycle you, you will never see what is happening there. That is a problem. And so, they keep selling these drugs. Maybe the governor doesn't even know. He doesn't know that they're selling the drugs. Because he has nobody to pretend the other person to check what is actually happening. I don't know whether you are aware, in around 2208, there was one dramatic thing that happened at Jute. When one of the big, is it the governor himself, disguised as a very poor person. They couldn't attend to him because they didn't know that he was the governor.
Let's talk about that.
They didn't know that he's the governor. And so the man disguised and came, he was pretending as if he was really sick. So the nurses will come and pass him. The nurses will come and pass him. It was one of the, okay, when even they called the medical director, they said there's somebody who is dying, they said, take him, no money to treat him. And it was the governor of the state, in Plateau here. In Plateau here. The man just disguised himself, just to find out, to hear what people are saying. Then he discovered that it was true. A lot of nurses, those nurses that were on duty that day, and the doctors, they were sacked at that time. They were sacked. Because when they now realized that he was the governor, they started running skeletons started dressing him, cleaning him. But that was rubbish. The man woke up and said, then all the security people came and noticed that it was the governor. So, sometimes you must put some checks to see that this thing that's supposed to go to these people is going. Because our medical people are also our problem too. They are our problem. They prefer to steal all the drugs that you have supplied, that you have bought, and then take it to a private clinic. They value their clinics more than the public clinics, which we cannot allow that. What is meant for common man like me should be given to the common man. It is only the rich man that goes to a private clinic because he is rich. But why is the government there? Government is to do for us, we are the poor people. And so everything that government has made, we should benefit from it. But these people will not allow us, they will just go and give it to the private people. And when you go there, a drug of maybe 2 naira, they will tell you 5 naira. And you cannot afford that 5 naira. Then you find that eventually the patients die. So we must be able to check these things. And we hope that we'll do that.
Amen, sir.
Thank you.